Assalamualaikum and hi to Miss Fatin and everyone. Today we are going to present for our AP presentation. Before we begin our presentation, let us introduce ourselves first. My name is Muhammad Arif Farhan bin Muhammad Zamel and my matrix number is 200393.
And my name is Muhammad Azri bin Muhammad Azib, and my metric number is 201054. Okay, so let me present for our AP presentation. Okay, firstly, I want to raise a question to you all. Does engineering can be related to medical field? The answer is yes, they do. Next slide. Okay, this bar chart shows the statistic of job market growth rates by engineering specialty. This shows that biomedical engineering has the highest rate compared to others, which is 27%. This shows how great job opportunity for biomedical field. Okay, next. This graph also proves how this sector increased in its number of employment from 1999 to 2011. Next. I know that all of you is an engineering student, so you can grab this chance by taking this opportunity to travel further in this sector, as it is really require many engineers from year to years. So biomedical engineering is the application of the principle and problem solving techniques of engineering for healthcare purpose. Next. So today we are going to talk about the importance of biomedical engineering in medical field. Uh, For info, we as a student of mechanical engineering, we also got info from Arif uncles who work as biomedical engineers at hospital. Okay, next. Our presentation today will be divided into three parts, which are the introduction, the two importance of biomedical field, and the conclusion that my partner Arif will conclude at the end of our presentation. Thanks. Surely, I guess that all of you are wondering from inside, what is the purpose of our presentation? Next. So, I would like to expose to the audience that biomedical engineering can close the gap between the engineering and medical field and can help to advance the healthcare treatment around the world for solve worldwide health issues, helping to change how patients are treated, and lowering the cost of care. Next. The first main point is the usage of biomedical electronics in healthcare. Next, firstly, in my opinion, I think the use of machines and robotics during surgery is really necessary nowadays. For example, it is faster in time compared to traditional surgery, which sometimes take all day long for a complex surgery. Moreover, it is more accurate, so by this way, machines and robotics help to lower the mistake that can be made by doctors. I don't mean that doctors are not skilled, but we know that all humans are not perfect and sometimes doing mistakes too. Therefore, with the help of robot, we may reduce the risk of death during a complex surgery. Next. Secondly, biomedical engineers that expert in machineries also really important because they are assigned to maintain and repair the devices and robotics in the hospital that are used regularly. By this action, it will ensure the efficiency of the device and improve the safeness of the device, which means the surgery will be done in a safe manner. That's all from me. I will pass to Arif for the next main point and the conclusion.
Okay, for the next main point is importance of biomedical engineering in medical field is X-ray machine improvement. So there are many types of X-ray machine in this photo is CT computerized tomography, which will produce cross-sectional image or slices to form 3D image. The main field in which X-ray machines are used in medicine are radiography, radiotherapy, and fluoroscopic type producers. So, by improving the X-ray machine, it can actually help the doctor to easily identify the type of cancer, and this will automatically help to reduce the time wastage. So, some of the image of X-ray machine take a few weeks or months to identify the cancer by observing the black and white X-ray image. The normal X-ray machine can only give few information and type of the cancer, such as the size and the shape only. So, as we can see in this slide, on the left side, we can only see the black and white image. By observing this image, it will take a long time to identify the type of disease for this patient. On the right side, the X-ray image is in color, which might determine the type of disease or the condition of the cell of the body itself. This can reduce the time for the doctor to identify the disease. For the next point is to reduce the exposure of radiation from magnetic wave. The normal X-ray machine exposes you to the radiation that can give you a cancer, and in fact, X-ray machines are widely used in the hospital to identify the cancer. So we can never run from the X-ray machine. So engineering can help to reduce the damage to our skin due to radiation from the normal X-ray machine. Maybe the engineering can find the alternative to reduce the damage of the radiation so the patient will receive the less damage. For the conclusion, it is proven that engineering is really important in medical field. We have seen that medical is actually rely on engineering in many things. Engineering have made uh, most of the medical things become easier. We have tell you about the biomedical electronic in healthcare and also X-ray machine improvement for our presentation today. So with this invention of the engineering in medical field, some of the surgery procedure are no longer complicated with the machine they invent. Gordon Lindsay Glegg, a British engineer, he said that the scientists discover a new type of material or energy, and the engineer discover a new use for it. Engineering job is a great scientific adventure, but also a great human adventure. Thank you for your attention and thank you for listening to our presentation today. It was a pleasure to be given this opportunity to present our topic for today. Well, that's all from us. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh and thank you.